Thank you very much, Sue. I'd like to begin by acknowledging the traditional owners on whose land we are gathering here today, and I pay my respects to the Wurundjeri people of the Kulin Nations and to their elders, both past and present, and acknowledge any elders who may be with us here today. Can I acknowledge Dale Fisher, the CEO of the Peter MacCallum Cancer Centre, Sue Matthews, the CEO of the Royal Women's Hospital, and Liz Hamilton, Acting CEO of Bendigo Health, the members of the Project Advisory Group guiding Stage 3 of the Strengthening Hospital Responses to Family Violence project, today's facilitators and presenters, particularly to Katie, who will shortly share with us her great courage as a survivor of family violence. Can I thank Emma as well for her very moving poem in tribute to my late colleague Fiona Richardson. It's been a pretty difficult week for members of the government, and it's also with great sadness that I pass on to you Minister Jill Hennessy's apologies, also our Health Minister, who is unable to be here today as she has just this week lost her own mother. So it's been a very difficult week, and I'll pass on Jill's apologies. She obviously would have wanted very much to be with you here today. We are here to learn, to share, and to ultimately improve our hospital's responses to patients who are experiencing family violence. People like Katie, herself a survivor of family violence, who will be talking to the forum later. And I'd like to extend a warm welcome to those joining us from our regional and rural health services. I'd like to start by thanking the Royal Women's Hospital and Bendigo Health for co-hosting this important forum for the Victorian health service sector. The Victorian Government is committed to addressing family violence in all its forms across our community, because family violence is a serious issue with proven impacts on health. Family violence is a leading contributor to death, disability and ill health for Victorian women aged between 15 and 44 years. Now, we know that victims of family violence are likely to access health services and that most people place considerable trust in the advice of their health professionals. This is an opportunity for early identification, improved responses and referral for victims. Putting in place a hospital-wide system response will not only improve health outcomes for people experiencing family violence, but it will save lives. This is why we're resourcing public hospitals to implement a whole-of-hospital model for responding to family violence. This year's Victorian State Budget allocated $38.4 million over the next 4 years to fund public hospitals to more effectively identify and respond to people who have experienced family violence. This included $10.2 million in 2017-18 for health services to employ an implementation team, educators, and to address increased demand for secondary family violence consultation by our social workers. This has seen the Strengthening Hospital Responses for Family Violence initiative expanded to support all 88 public health services in Victoria using a train-the-trainer approach. It will see all health services provide training for staff to notice the warning signs, inquire sensitively, respond respectfully, and connect victims to family violence services. Equipping our healthcare workers with the right skills to identify and respond to family violence will save lives by providing them the help and the support that they need much faster. What's important is that there is best practice guidance, training, policies and procedures to support this. Importantly, the revised toolkit that's being launched today also guides managers to support colleagues working within a hospital who are themselves experiencing family violence. The Royal Women's Hospital and Bendigo Health will be supported to ensure that the model continues to be developed and to provide guidance for responding to other vulnerable groups and perpetrators of family violence. Post-training surveys have shown implementation of the model is increasing the capacity and the confidence of clinicians to sensitively identify and respond to patients who disclose experiencing family violence. To date, more than 3,000 hospital staff have received this training. Whether your service's response to family violence is in its infancy or more established, I congratulate you and thank the health sector for your incredible work. Sharing your achievements with all of us here today is one thing, but what is more important is why you are all here today. To share what is happening in your service, the achievements, the barriers, the innovative ideas, and to providing your feedback. It is this work and that of others which is critical in progressively rolling out a more coordinated service system, as was recommended by the Royal Commission into Family Violence. The forum is a wonderful opportunity to gain insights, options, tools and ideas to assist in paving the way forward. So I thank everyone involved today for your commitment to improving the health and well-being of those most at risk in our community. We have embarked upon a very ambitious reform agenda here in Victoria, and that is to end family violence. And we can only do that with all of your help. Thank you very much.